Women's Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, subscribe, and share. And please come back for more.
You know
See
that
you soon.
feeling when you're at the doctor's office and you feel kind of small, a little confused, maybe even vulnerable? Yeah, we've all been there. But it really doesn't have to be that way. Today, we're going to break down the fundamental rights that every single patient has, and more importantly, we'll show you how to use them to really take charge of your own health. So, to really get why this is so critical, let's just dive right into a real story. I want you to meet Mrs. Kate. What happened to her and her family, honestly, it could happen to any of us. And it all started with a situation that, well, every parent just dreads. Okay, so picture this. It starts with something that's super familiar to any parent out there. Mrs. Kate's child gets a fever. She does exactly what you're supposed to do, right? She rushes him to the hospital. They run some tests, they admit him. Everything seems pretty standard so far. But then, things start to feel a little off. For 2 whole days, her son is getting medication, some by mouth, some through an IV, and all this time, the parents, they're told absolutely nothing, just kept completely in the dark. I mean, just let that sink in for a second. There's no diagnosis, no one explains the treatment plan, and when they're finally discharged, the medicine they have to take home is just in an unmarked plastic bag. The labels on the original bottles, they've been stripped off on purpose. It's a total information blackout. So naturally, the parents do what any of us would do. They start asking questions. They just want to know what medications their child was given. Simple, right? But the hospital, they flat out refuse to tell that. Okay, seriously, put yourself in their shoes for a minute. You're worried sick. You are responsible for this little person's life, and the very people you've trusted to help are just shutting you down, denying you the most basic information. So what would you do? That question right there, that is exactly why we need to have this conversation about patient rights. The answer to that, frankly, terrifying question really lies in understanding the very foundation of your medical care. So let's get right into it. What are patient rights? Well, to put it simply, they're the basic protections that make sure you get healthcare with dignity, respect, and fairness. Look, these aren't special privileges. Think of them more like the ground rules for every single time you interact with a doctor or a hospital. And why does this matter so much? Because these rights, they translate directly into power, your power. They're what shifts you from just being a passive person getting treatment to being an active participant in your own care. It's literally the difference between blindly accepting whatever happens and confidently asking questions. It's what gives you the final say. Okay, so let's break down the specifics. What are these core protections you have every single time you step into a clinic or hospital? Right at the heart of everything is your autonomy. It's your right to control what happens to your own body. And this kind of breaks down into 2 key rights. First, you've got the right to informed consent. This means a doctor has to explain the what, the why, the risks, and the benefits before they do anything. But here's the other side of that coin, the right to refuse treatment. After you've heard everything, the final decision, it's always yours. Now, beyond just making decisions, your rights also cover information and privacy. You have a right to get information in plain, simple language, not a bunch of confusing medical jargon. And just as important is your right to privacy. We're talking about everything from a closed curtain during an exam to making sure your medical records are kept totally secure. Ultimately, what all of this boils down to is making sure you're treated like a human being, not just a case file. This means getting quality care from people who know what they're doing. It means being treated with dignity and respect. And, this one's huge, it means you have a right to emergency care when your life is on the line, no matter what your financial situation is. Okay, so knowing your rights is absolutely the first, most essential step. But, knowledge is only powerful if you actually know how to use it. So now let's build your toolkit for action. Let's talk about the practical things you can do to protect yourself. And it's really important to get this. These rights aren't just nice ideas or suggestions. In a lot of countries, they are legally binding. Take Nigeria, for example. You've got laws like the National Health Act that give these rights real teeth. So it's definitely a good idea to check out the specific laws where you live, because that's the legal framework that's got your back. So what happens if things go wrong? What if your rights are violated, just like in Mrs. Kate's story? Well, there's a clear step-by-step process. You should always start with the hospital or clinic itself. But, and this is so important, document everything. Keep detailed records of who you talked to and when. Put your concerns in writing. And if that doesn't solve it, you need to know that you can take it higher to external regulatory bodies. Of course, the best way to handle this is to be proactive, right? To get ahead of it. And these are really simple things you can do for every single appointment. Things like preparing questions beforehand, asking for simple explanations, even bringing a friend or family member with you for support. That's not a sign of weakness, that is a sign of being smart. These are the tools that put you in the driver's seat. All right, so we've covered the what, the why, and the how. Now it's time to bring it all home and talk about the single most important person in your entire healthcare journey, and that person is you. Look, if there's only one thing you take away from all this, please let it be this. Your doctors, your nurses, all the specialists, they are absolutely vital partners, but they are not the main character in your health story. You are. The number one most important advocate for your health is and always will be you. There's a line from the source material that just sums this up perfectly. It says, "You are your own advocate. No one knows your body, your values, or your needs better than you do." I mean, that's it right there. That is the essence of patient empowerment. So we've walked through the story, we've broken down the rights, and we've laid out an action plan. That really just leaves one final question for you. Now that you know your rights, are you ready to use them?
Please subscribe.